Good morning. My name is Dr. Francisco Ramos-Gomez. I'm a professor and chair at the University of California, Los Angeles. I want to bring you a welcome to all the Head Start viewers today. We're so thrilled and happy to learn about pediatric oral health, and now with COVID, all about the telehealth possibilities. So as you know, dental caries is really very bad infectious disease that occur in children under 5 years of age and others. And it really causes a lot of pain, infections, difficulty of chewing, and school readiness. It also is the #1 cause for missing days of school, and is very high cost for care. It unfortunately really affects our communities of color disproportionately. So in California, one of the ethically diverse states in the US, over 1.6 million children under 5 years of age already are the ones that get it. And also a lot of Latinos, unfortunately, are affected with carrying the major burden of the disease. So it's a chronic infectious disease that it is uh, a chronic infectious disease that is transmissible, but 100% preventable. So it's 20 times more common than diabetes, 5 times more common than asthma, and 4 times more common than obesity. Early childhood caries, an ECC, is any children under 5 years of age that has any cavitations, as you see here, or any cavities, and it's really caused by poor feeding practices, as well as poor oral health and hygiene. The first sign of early childhood caries is, as you can see here, are these white spot lesions. If you can see right below me, right there, is these chalky lesions that are around the tooth that will be the first signs of the mineralization of the enamel before they start really creating the holes on the tooth. So it's very important that you, as a Head Start staff and parents, can really address this issue if you notice any of these dull white spot lesions, to do something about it. And the rationale behind it is that when you have a lot of sugar and sugary foods and drinks, especially with sodas, and you have bacteria in the mouth, it's going to create the acids, and the acidity is going to start causing this demineralization of the enamel very early on that you can see in there. We're the promoters of the H1 visit. That means that all the pediatric dentists like myself and others, we're really welcoming infants and toddlers in our dental practices. So after the first tooth in the mouth, first birthday, you should all go and get seek some oral health assessment of your child, so we can really have a good sense if any of these demineralization is already happening in your child's teeth or your child's mouth. The children should see the dentist regularly. The checkups are every 6 months. We really have a whole protocol for infant oral health where we can really reduce the burdens of disease and reduce for any of you to seek emergency care instead of just regular care. You do not wait until your car is really burning in the middle of the highway to bring them to the maintenance, right? You take your car every certain amount of miles or time, the same as your teeth or your child's teeth. It's so important that you keep a maintenance schedule. And very simple things will make this happen. Brush teeth and gums gently with a small soft baby toothbrush. Brush twice a day, and use fluoridated toothpaste is essential. It's very important. And please do not share your toothbrush with your child or among the children themselves. There is a universal use of fluoridated toothpaste for all. That means that every child should be using from the first tooth in the mouth a smear amount, as you can see here, under 3 years of age. And after 3, then you can do like half a pea size or the pea size amount, as long as they can spit. But for infants and toddlers, you need to really have them exposed very early on to fluoridated toothpaste, not training toothpaste, fluoridated toothpaste, as soon as the first tooth is in the mouth, 9 months, 10 months of age of the baby until their whole lifetime. And these are the toothbrushing techniques. You have to be very gentle, almost with 2 fingers. Do your toothbrush. Don't put a lot of force. You have to be gentle moves and just be very strategic, starting from an upper right side to the upper left and lower right and lower left. So just keep yourself a structure that is simple for you. Everyone is asking me, when is flossing going to be recommended? Well, flossing is recommended when the child is old enough, after you really manage and conquer the brushing techniques, then you can do into the flossing. But what parents are not aware, or school teachers like you or Head Start teachers, is that you guys are responsible of children's oral health and their cleanliness and the brushing until the child is 8 years of age, when they can tie their shoelaces or they can actually have the motor capacity to do it themselves. You mean a 3-year-old might play with a toothbrush, but they're not really brushing the teeth. You, the parent and the caregiver, are responsible for brushing your child's teeth. So find some good tips, good positionings. Place your child on the floor and sit behind them, or a chair stool, whatever makes you uh, simple and easy. The Academy of Pediatrics is really recommending to have like a bonding experience when you do the toothbrushing, like reading a little book or singing a song as part of that toothbrushing, and make it kind of very simple, routinary issue in your household. So there's a lot of concerns about bottle use and breastfeeding, especially it's not the breast milk or the bottle milk that is going to be the ones affecting, is the constant exposure of the breast milk and the bottle in this child's teeth and gums. So it's very, very important that you, if you want to continue to breastfeed after 1 year of age, when is the winning recommendation from the Academy of Pediatrics, start weaning your baby after 1 year of age. If you continue, it's your own decision making, and we have to respect that. It's just to do it responsibly, meaning that after you have a feeding, you cleanse the teeth with a wet gauze, with a cloth or something, just to remove whatever residuals are in there, and try to brush your child's teeth. I know you put them to sleep with the ball of the breast, and you don't want to arouse them, but the idea is to really cleanse them and leave at least some fluoridated toothpaste in there. The last thing that touches your child's teeth should be the fluoridated toothpaste. And try not to give any sugary foods or drinks for these children before they go to sleep. So gently wipe the gums every day, or cleansing, even though the child has no teeth at all. It'll be fantastic that you can really do as they're doing right in there, where you can actually go ahead and do a nice cleansing in the child's teeth. So what about juice and sippy cups, and the recommendations here to try to reduce any sugary foods or drinks on children under 3 years of age. That's the main recommendation. So just plain water, tap water, filtered tap water is very good. We're going to talk about that, how relevant it is that you expose your children to filtered tap water. If you don't like filtered tap water, just boil it or make it available as part of the environment, not to use a lot of plastic bottles. But the reason is that there is fluoride, a little amount of fluoride in this tap water, which has been considered one of the most successful prevention strategies in public health ever. And also try to not to give that juice or introduce these children very early on to juice, because some of the juices, those juice boxes might have 30, 40 grams of sugar, and sometimes with artificial coloring. So try to be very, very, very smart. Teach parents how to read labels and ensure the sugary reduction in children under 3 years of age. So take a look for parents to make sure that they check on this in the neck of the teeth before the gum line. Check if there's any of those white spot lesions or the plaque that can be shown in there. So we ask the parents to flip the lip of their children, and you guys can do the same, just to check that the child is perfectly fine. And this is what healthy teeth should look like. You can see here how nice the gums are, how nice they are, pink and a little bit on the whitish side. It has to be shiny when you shine the light in there. It should be pretty healthy. But look at the ones when they have any signs of infection already there. You can see already there's some cavitations and there's some brown spots, and those white spots can become brown, and then to the point of no return, where there's very little we can do for these children. And this is how the progression of disease is going, right? The white spots is the first sign. That's why we really want to alert you, all of you, to be very, very cautious and look for almost like a detective, to ensure that none of these lesions are happening, because those lesions will become brown and then they will become black. So I mentioned about how safe it is to use tap water, and fluoridated tap water. It's so important that you filter it. If you don't feel like you can trust your water systems. Just do filters. There's Brita, there's Purr. There's several things that you can do with no problem. Then stop drinking the bottled water, because bottled water most of the times have no fluoride in it, and you're also contaminating and polluting the environment. There's a whole island of plastics around the Pacific Ocean, so you don't want to contribute to that. But this is something that's called Stefan's curve. I want to describe to you that all of us in our mouth, let's say I haven't had any lunch or any food this afternoon. So the idea is that we are at 7. That's our neutral pH up here, as you can see right there. And that pH of 7, let's say if someone gave me a bag of M&Ms and I have one M&M, it will drop me to a very critical pH of 4, where it's very acid. There's a lot of acidity in this place. And let's say if I just took one M&M, it's going to take anything from 20 to 30 minutes to go back to my neutral pH. Not very alkaline or basic, and not very acid, right? Which is, you want to be here in the neutral pH of 7. But what happens, especially now with COVID, a lot of parents are using a lot of these feeding practices in children to monitor their behaviors or to make them feel better. And they give them a lot of food throughout the day and the night. And that's what we really try to make sure that you stay away from all the zone of critical pH where the demineralization of the enamel happens very fast, very soon. So if you're gonna give food at one time, give it at one time, and give it a rest, give it some respite for several hours before you give other snacks and other intakes throughout the day and the night. It's very important that last thing that touches your child's teeth should be the fluoridated toothpaste and nothing else, perhaps water if you want to, but nothing else until the next morning. I hope this is clear. It's a very important concept that I hope all the Head Start teachers and the parents can understand, the need to really reduce the amount of snacks and the amount of sugary foods throughout the day and the night. And you'll be surprised of how many sugar contents there are in these kind of drinks that you can see in here, right? You see how many ounces. Just Mountain Dew, they say, is the worst thing ever, because see how much sugar is in there. And simple things, even like healthy waters, there's so many vitamin waters that are out there, you'll be shocked and surprised how much sugar they're in there. These are the worst, and I'm talking about the brand. These are just any pouches. We call them junk on a pouch. Any of you will be alarmed to know the amount of sugary drinks and sugary amounts in these pouches. They're really, it's a crime of how some of these manufacturers, they sell them as organic baby food, and others claiming that they might be safe and organic. The amount of sugary foods are just overwhelming. So I'm going to show a little video now about brushing your child's teeth, so you guys can have a little bit of sense of where things are.
Here is a guide on how to take care of your children's teeth at home. Just as a reminder, care at home is important. It does not substitute visiting your dentist every 6 months. It is important to see a dentist even if your child seems healthy and does not have a problem chewing or eating. Here is how you can take care of your children's teeth at home. Brush your children's teeth twice a day, after breakfast and before bed. Always use fluoride toothpaste and a soft toothbrush. Fluoride is safe and it helps prevent cavities. It's important to remember the last thing that should touch your child's teeth before bedtime is a toothbrush with fluoride toothpaste. If your child isn't old enough to brush his or her own teeth, make sure you or another adult brushes his or her teeth until they are 7 or 8 years old. The photo on the left shows the appropriate amount of toothpaste for a child under 3 years old. It is essentially a smear of toothpaste about the size of a grain of rice. The photo on the right shows the appropriate amount of toothpaste for a child older than 3. It is equivalent to the size of a pea. Toothbrushing helps prevent tooth decay and gum disease. Your child's first dental visit should be around their first birthday. It is also important for caregivers to maintain their oral health and regularly see the dentist for cleanings and checkups. First, wash your hands with soap and water for 20 seconds. Gloves are not needed, but can be used if you have available at home. This is the knee-to-knee technique for toothbrushing when 2 adults are available. If you have someone at home to help, it is easiest to sit facing each other with your knees touching. To start, the helper will hold the child facing toward them with the child's legs wrapped around the helper's waist. The child's head and body are gently lowered into the lap of the brusher. The helper's job is to hold the child's hand throughout the brushing. It is important not to let go of the hands until the brushing is finished. When two adults are not available, brushing can be done by one person. There are various positions you can try when your child is young. Try sitting on the floor with your legs open. Your child can lie down on the floor with their head between your knees. Another way that can be helpful is using the changing table when doing the brushing. Brushing a young child's teeth can often be very challenging. It will get easier over time. If your child isn't cooperating during brushing, you can always use toys, singing, or other games to make brushing more fun. Next, you can go ahead and brush your child's teeth using fluoride toothpaste. Circular motions are recommended to best clean your child's teeth. Lift the upper and lower lips to better clean the front teeth. Focus around the gum line and don't forget the back teeth. Brush all sides of the teeth, including outside by the cheeks, top of the teeth where your child chews, and inside by the tongue. Sometimes the gums bleed when you brush. This is usually a sign the teeth and gums need to be brushed more frequently and thoroughly. Keeping your child's teeth healthy means more than just daily brushing. Maintaining a well-balanced nutritional diet can protect teeth from cavities. Always limit the amount of sugar and juices. Drinking tap water is also very important. Fluoride is a substance found in water, and it plays an important role in healthy teeth development and cavity prevention. So the next time you grab a glass of water for your child, consider getting it straight from the sink or through a filtration system. Even though baby teeth will eventually fall out, it's important to take good care of them. Baby teeth are very important for proper chewing and eating, the development of normal speech, providing space for the permanent teeth and guiding them into the correct position. It is also important to remember that if tooth decay is not prevented, it can be costly to treat, cause pain, and lead to life-threatening infections. Pay close attention while brushing your child's teeth. Here are some indicators that your child might have cavities. Healthy teeth should all be one color. A stain on your child's teeth may first appear as a white spot. If the white spot is left to persist, it will eventually worsen into a hole or pit in your child's tooth. If your child is complaining of experiencing pain while chewing, particularly in a certain area of the mouth, this could mean that your child has a cavity. As tooth decay progresses, the tooth with a developing cavity will have dark areas, or the entire tooth may become darker. Look for chips and cracks in addition to holes in your child's teeth. Other signs of tooth problems are fussiness or mood swings, avoidance of eating, swelling around the mouth area. It's important to remember the last thing that should touch your child's teeth before bedtime is a toothbrush with fluoride toothpaste. The best way to know if your child has a cavity, of course, is to schedule an appointment with your child's dentist. If you have any questions, please contact us.
So we also have this video in Spanish, so I'm going to put it in for the Spanish-speaking families as well that may be listening to us today.
Esta es una guía sobre cómo cuidar los dientes de su hijo en casa. Solo como recordatorio, el cuidado en el hogar es importante, pero no sustituye la visita al dentista cada 6 meses. Es importante ver a un dentista incluso si su hijo parece estar sano y no tiene problemas para masticar o comer. Así es como puede cuidar los dientes de su hijo en casa. Cepille los dientes de su hijo 2 veces al día, después del desayuno y antes de acostarse. Utilice siempre pasta de dientes con fluoruro y un cepillo de dientes suave. El fluoruro es seguro y ayuda a prevenir las caries. Importante, lo último que debe tocar los dientes de su hijo antes de acostarse es un cepillo de dientes con pasta de dientes con fluoruro. Su hijo no tiene la edad suficiente para cepillarse los dientes. Asegúrese de que usted o otro adulto le cepille sus dientes hasta que tenga 7 o 8 años. La foto en la izquierda muestra la cantidad adecuada de pasta de dientes para un niño menor de 3 años. Es esencialmente una cantidad del tamaño de un grano de arroz. La foto en la derecha muestra la cantidad adecuada de pasta de dientes para un niño mayor de que es el del tamaño de un chícharo. El cepillado de los dientes ayuda a prevenir las caries y la enfermedad de las encías. La primera visita al dentista de su hijo debe ser alrededor de su primer cumpleaños. También es importante que las personas que cuiden a su hijo mantengan su salud bucal y visiten regularmente al dentista para limpiezas y chequeos. Lávese las manos antes de cepillar. No se necesitan guantes, pero se pueden usar si los tiene disponible en casa. Esta es la técnica de rodilla a rodilla para cepillar los dientes cuando hay dos adultos disponibles. Si tiene a alguien en casa para ayudar, es más fácil sentarse uno frente al otro con las rodillas tocándose. Para comenzar, el ayudante sostendrá al niño girando hacia ellos con las piernas del niño envueltas alrededor de la cintura del ayudante. La cabeza y el cuerpo del niño se bajan suavemente hasta las piernas de la persona que va a cepillar los dientes. El trabajo del ayudante es sostener la mano del niño durante el cepillo. Es importante no soltar las manos hasta finalizar el cepillado. Cuando no hay dos adultos disponibles, el cepillado lo puede realizar una sola persona. Hay varias posiciones que puede usar cuando su hijo es pequeño. Intente sentarse en el suelo con las piernas abiertas. Su hijo puede acostarse en el suelo con la cabeza entre las rodillas. Otra forma que puede ser útil es usar el cambiador para cepillar los dientes. Cepillar los dientes de un niño pequeño puede ser muy difícil. Se hará más fácil con el tiempo. Si su hijo no coopera durante el cepillado, puede cantar, usar juguetes o otros juegos para que el cepillado sea más divertido. A continuación, cepille los dientes de su hijo con pasta dental con fluoruro. Se recomiendan movimientos circulares para limpiar mejor los dientes de su hijo. Levante los labios de arriba y abajo para limpiar mejor los dientes de enfrente. Concéntrese alrededor de la línea de las encías y no olvide los dientes de atrás. Cepille todos los lados de los dientes, incluido el exterior alrededor de las mejillas, la parte superior de los dientes donde su hijo mastica y el interior hacia la lengua. A veces las encías sangran cuando se cepilla los dientes. Esto es una señal de que los dientes y las encías deben cepillarse con más frecuencia. Mantener los dientes de su hijo sanos significa más que un simple cepillado diario. Mantener una dieta nutricional puede proteger los dientes de las caries, limitando siempre la cantidad de azúcares y jugos. Beber agua del grifo también es muy importante. Cloruro es una sustancia que se encuentra en el agua, es seguro y es importante en el desarrollo para dientes sanos y la prevención de caries. Por lo tanto, la próxima vez que tome un vaso de agua para su hijo, considere sacarlo directamente del grifo o mediante un sistema de filtración. Aunque los dientes de leche eventualmente se caerán, es importante cuidarlos bien. Los dientes de leche son muy importantes para masticar y comer adecuadamente, el desarrollo del hablar, proporcionar espacio para los dientes permanentes y guiarlos a la posición correcta. También es importante recordar que si no previenen las caries, su tratamiento puede ser costoso, causar dolor y provocar infecciones potencialmente mortales. Preste mucha atención mientras se cepilla los dientes a su hijo. Estos son algunos indicadores de que su hijo podría tener caries. Los dientes sanos deben ser de un solo color. Una mancha en los dientes de su hijo puede aparecer primero como una mancha blanca. Si deja que la mancha blanca persista, eventualmente empeorará y se convertirá en un agujero o un hoyo en el diente de su hijo. Si su hijo se queja de sentir dolor al masticar, especialmente en una área determinada de la boca, esto podría significar que su hijo tiene caries. Cuando caries dental progresan, un diente con una caries en desarrollo tendrá áreas oscuras, o todo el diente puede oscurecerse. Busque dientes quebrados o con hoyos en los dientes de su hijo. Otros signos de problemas dentales son cambios de humor, no querer comer y hinchazón alrededor de la área de la boca. Es importante, lo último que debe tocar los dientes de su hijo antes de acostarse es un cepillo de dientes con pasta de dientes con fluoruro. La mejor manera de saber si su hijo tiene una caries, por supuesto, es hacer una cita con el dentista de su hijo. Si tiene alguna pregunta, por favor, contáctenos.
So I hope you guys found those videos very, very relevant and important. Please make sure you play. That's why we have them in English and in Spanish for you. Well, now we're moving along about telehealth and what are we doing now to improve oral health through education, through the virtual platform like we have at the moment. So we're using now, I guess, part of our daily lives, our Zoom meetings, our telehealth programs. We're trying to, and maybe I can put myself right in there, to strategically use telehealth so we can actually access all the populations and vulnerable communities we're trying to reach. So it's so important that we are able to have some platforms for our patients and families we're trying to reach. So for that, we are going to just discuss a bit now about our 6 steps of infant oral health. What is what dental providers are doing now with your infants and your toddlers? So we use a CARES risk assessment tool that goes through some very specific questions on risk factors, protective factors, and then clinical findings. And we're able to project and to predict if your child will have disease early on or will have cavities in the near future. So we do a knee-to-knee exam. So the parent is here and the provider, and we are really working with the caregivers so they learn about all the things they have to be looking for, and most importantly, to do a good toothbrush prophy, meaning that we're going to be brushing your child's teeth very nicely through this effort, right? Then we're going to do a clinical exam. Remember, we're trying to reach for the white spot lesions. We're trying to see what are the white spot lesions that are happening. And then we have this very nice, this very cool, that you see right in here, this fluoride varnish that we're going to be varnishing all your child's teeth right in there, which are vitamins in your child's teeth. And we're going to try to prevent any disease. This are strengthening the enamel and make it so much stronger in the future. And also we finish with some anticipatory guidance or some self-management goals based on your needs and your preferences to say the last thing that touches your child's teeth should be the fluoride toothpaste. Please, let's do that for the next time. Is there the use of fluoride toothpaste, the use of tap water, anything that you leave them with as their self-management goals. And you ask them from 0 to 10, how sure you think you can do it? And if they give you a 7, 8, or 9, that's great. If they give you a 1 or a 2, that means that they're not ready for that one. So you move into the next one. We leave them only with 2 things to do for the next time. So for all of you, also we have our training, we have a curriculum, and we welcome any of you that might be interested to look into our website. It's right there. Our UCO website is the UCLA Children's Oral Health Project, where we actually train community oral healthcare workers to go through all of these things with parents to prevent disease and to really bring to their awareness oral health as part of prevention, to keep healthy teeth healthier and not in disease. And for that, I recommend you, this is an interactive part. I hope you all guys have your cell phone with you. If you just go to this exercise, it's called Smiles for Life. It's an amazing, it's a very nice website that you can actually do. I'm not sure you can see it in there or not. Maybe you can, but because of my thing. But the idea is that you can actually reach, there you go, maybe over there. It's free of charge and you can download very nicely. And a lot of this information we're giving you with photo galleries and information pertinent to children's oral health will be right there for your disposal. And it has some great preventative dental visits. And it tells you all about all the prevention things that we have to do, that they're so important that you really, really bring all these children by their first tooth in the mouth, their first birthday, or their first 12 months of age. Before the 12-month vaccination, they should come for their fluoride varnish vitamins. And also I want to make a shout out to pregnant women. It's so important that we start with pregnant women with pregnancy. We welcome all pregnant women in our practices to really prevent disease, because whatever happens in the mom's mouth, it's going to mirror their baby's teeth. So it's so important that you really start all of these great prevention and interventions with pregnant moms is the best time. So in summary, my dear friends, I hope you get a little bit of knowledge now of oral health, that every child should receive their dental exam, the risk assessment by age 1. to teach parents or healthcare providers or you or the Health Start staff to just lift the lip of the child to just to check for any of those white spot lesions, to ensure that the children are drinking tap water as well. It's very, very important. The use of fluoridated toothpaste twice a day. Remember, smear amount, little amount before 3 when they cannot spit, so they will swallow on half a pea-size amount or a pea-size amount after the age of 3. And remember that all of you, parents and caregivers, are responsible for their children's toothbrushing until they are 8 years of age. So I hope all of you repeat with me, 2 is too late, which is so important. I hope you say it for me. 2 is too late, yes. By age 2 is too late. We have to promote infant oral health for all of you and your communities. We want to thank you so much for your presence today. Please, if you have any questions or any inquiries you have, any more ideas, please write us. Again, my name is Dr. Francisco Ramos-Gomez at the UCLA School of Dentistry, and this is part of our UCO program. And also we have a wonderful funding award from the HRSA grant to really promote oral health and school readiness for our Head Start partners like you. Thank you with that. I want to thank you so much. Have a great day, and please stay together, stay united. And when you think about children's oral health, you have to think about that a child without oral health cannot have total health. Thank you so much. Have a great day. Take care. Bye-bye.